Hey guys, it's me, Jeanette, aka Sweet Jean, and I just wanted to come on here and give you an update of my gynecologist oncology update with my results. So I saw my doctor, and he said that the ultrasound came out fine. However, there was a polyp in the uterus, and so he also ran blood work, which does in fact show that I am producing estrogen like I suspected. He was trying to say that maybe possibly the polyp was what was causing the I hate to say this because I don't want this video to get flagged, but the bleeding. And so I knew that it was not that type of, it wasn't vaginal bleeding, it was a menses, it was a cycle. But of course, him being a man doesn't understand that me being a woman understands the difference between vaginal bleeding and a menstrual cycle. So anyhow, I didn't want to go against him and say no, you're wrong without the results, because there was a slim chance that it was possible that he was right, but I very much doubted it. I mean, I could have put money on it that he was wrong. But anyhow, he and my oncologist got together and spoke, and then I had an appointment with my oncologist, Dr. C. And she and him said that there were two options for me. One, they could put me on hormone suppressant medication, hormone suppressant therapy, and a hormone suppressant injection every month. So it would be on hormone suppressant medication pills daily, and monthly get an injection to suppress the hormones as well. And then with that comes symptoms, which are sometimes not very nice, and so I would have to have additional pills to combat the symptoms. And at this point, I'm already taking 12 pills a day, and they're not little pills. Like, actually, I think I have some in my pocket, because I didn't have time this morning to throw them in my mouth. And so, oh my gosh, 1, 2, 3, I'm missing one of the little ones, but I don't know if you could see, but I take, there's 3 of the pink ones. I take actually 4. It's in my pocket. I just can't get it because I have other things in there too. And then that peach one, I take 2 of those in the morning. So that's 1, 2, 3, 4, 5, 6. 6 pills in the morning, and then I take 6 pills in the evening. So I'm already taking 12 pills a day, and that's my chemotherapy medication, Tykerb and Xeloda. And then I'm going to need to add to the 12 pills the hormone therapy suppressant medication, which I don't know how many pills that's going to be. And then the pills to take to combat any symptoms, and I don't know how many pills that'll be. So it was either add additional daily pills for the rest of my life, and then be combating additional symptoms aside from the symptoms I already get from my chemotherapy, or the other option was to have a hysterectomy. And I don't know why I got so emotional. I don't know why I'm getting emotional now, but when I found out I had cancer before I knew that it had spread in other places, I was already set in my mind to remove my breasts, to remove both. I was going to tell my doctor, my oncologist, remove my breasts, remove both of them. I don't want them. I don't need them. I'm an old lady. I have no use for them. Remove them. But when I found out at my appointment that it had spread to other organs, there was no need to remove the breasts. And I was like, made up my mind, remove them. I don't want them. But when it came to them telling me that they were going to, do a hysterectomy, I was like, wait a minute, hold on. Why are we doing surgery, or why is that? Aren't there other things that we could try? Shouldn't surgery be the last option? But I just didn't want them to remove any. I don't know. I felt like, I understand that when females and males, but mostly females, when they have breast cancer, it is very traumatic and dramatic and all these other emotions. When they have their breasts removed, they feel less of a woman. They don't feel feminine. They feel sometimes their body's left looking ugly and looks like mutilated and stuff, and it's very, very depressing, and a lot of them go into depression. It's very emotional, and it's like years for them sometimes to be okay with it, or to get through with it, or just to live with it. And I don't know, for some reason in my case, when I found out that I had the breast cancer, I was like instantly thinking remove them. Like I didn't want them and I didn't need them. I'm not going to miss them. But having them tell me that they're going to remove my uterus or my ovaries, I was like, wait a minute. Like, wait. I feel like, I don't know. I don't know, like less of a woman. I don't know. And I'm like, isn't there other options? I wish I had tissue in here. So anyway, I think I was just scared also because it's surgery. And in order to have the surgery, I would have to stop my chemotherapy. And the chemotherapy is what's keeping my cancer from spreading. And I don't want to like not take it, even though it makes me sick. And it makes me not feel good. It makes me weak and fatigue and other things, you know, like I get cramping in my body, mostly in my abdomen and in my back is where my main cramping is, and I get it every day, and it's throughout the day, and I just have learned to just accept it and live with it. And sometimes it stops me in my tracks, but you know, I just wait for it to subside because it comes in waves, and then I just continue on my day. So I don't know where I'm going with this. It's just I was scared to like have the surgery because I didn't want to stop the chemotherapy, because I don't want the cancer to have a chance to spread further, because I already have it, you know, like I've said before in my previous videos. But if this is the first video you're watching of mine, I have stage 4 advanced metastatic breast cancer. I have it in my breast, my lymph nodes, my chest, my neck, my liver, my right lung, and in my bones. The medication that I'm on now is my second treatment plan, because the first one worked for about a year and a half, and then it stopped working. So now I'm on another medication plan. And so well, I'm losing my train of thought. So anyhow, I have it spread to those organs, and I just don't want it to spread anymore. And having surgery, I'm gonna have to stop the chemotherapy for weeks at a time. And then also I was scared because I didn't really know about that surgery, but I kind of voiced my concern on a Facebook group that I'm a part of. It's a support group of women who have stage 4 metastatic breast cancer like me, and a majority of them said that the procedure nowadays isn't really that bad, and it's an in and out type thing, and recovery is like weeks as opposed to how it used to be back in the day. And that most everybody that has had this surgery, they were okay, they were fine, there were not really no complications, and they don't menstruate anymore, and you know, blah blah blah. I think I only had one comment that said that they did remove it, they did have a hysterectomy, but they were still needing to be put on some type of hormone therapy, but it's not at the extent of if she didn't have it done. Like, it's a lighter dose. So anyhow, I am going to get the surgery. I don't know why I'm being such a big baby about it, and I'm sure people and women who are looking at this video who have had the surgery, they're probably like, what is the big deal? Just get it done. It's no big deal. In and out. Recovery's 2 to 4 to 6 weeks at the most. It's a piece of cake compared to other surgeries, but I guess I'm just a scaredy cat when it comes to surgery. And also just the thought of them removing my uterus or my ovaries, like my female parts, is just makes me feel a bit less than a female. if that makes any sense. And I think I've always been an emotional person. Like, I just feel things, like they hurt my feelings easily, or I get emotional easily. I've always been like that. But I think recently, because I had stopped producing hormones for a few years, but I think recently, since my body started producing them, I've been getting more emotional and easily to cry. And I think I've just proved that theory. Anyhow, so I am going to have the surgery. I am going to be meeting with my doctor next week to discuss when I will be scheduled to have that done. I'm planning on a trip next week, and we're going to be out of town for a good 7 to 10 days, and then I'll schedule the surgery. But of course it depends on the surgeon as well and when they are available. But I definitely want to be healed by Thanksgiving, by fall holidays. But anyhow, I know this is a very long video, and I appreciate you all that have hung in there. But that is the final verdict. I'm going to have a hysterectomy to combat the hormones that my body's producing that I shouldn't be producing, because my cancer is driven by hormones, by estrogen and progesterone, and I don't need to be feeding the cancer and giving it a chance to spread and have a party in my body. But anywho's, you weren't invited to the party, cancer. You need to leave. So anyhow, thank you guys so much for listening to me. I really appreciate it. If you liked me, if you liked the video, give it a thumbs up. All the usual things that YouTubers say. Give it a thumbs up, give it a like, comment, rate, subscribe, and all that good stuff, and click the notification bell so you're notified of videos when I do upload. Again, thank you again, and I will catch you in the next video. Thanks. Bye.